Since insomnia is such a big problem in pregnancy, we know that a lot of people experience it. We often see people who want to have more information about taking medication for insomnia during pregnancy. So today we want to talk to you about Trazodone. I'm Dr. Nichelle Haynes.
I'm Dr. Kristen Lassiter.
And we're medical mamas. This is your place for evidence-based information about your reproductive mental health.
Meaning mental health in relation to reproductive hormone changes like around pregnancy, postpartum, menopause, premenstrual disorders, and infertility.
So today we're talking about Trazodone, which I feel like is a relatively commonly used medication for insomnia outside of the perinatal period, outside of pregnancy and postpartum.
Yeah, and the brand name most commonly is Deserel.
Oh yeah, I mean, I don't really think anyone uses that medication or uses the brand name.
But it's the medication that's used by a ton of people outside of pregnancy. But in pregnancy, we actually don't use it very commonly because there's not a lot of research.
We should make that a thing.
Yeah.
Like a or like womp womp.
Yeah, I mean, and I know we say that about
Everything.
a lot of medications, but this one really, like, when we're looking at does it cause an increased risk of birth defects, they've studied like 300 pregnancies, which is really low.
Yeah, I mean, that's embarrassing.
It
It's
is
abysmal.
It is.
Not cool. Not cool. Okay, so let's talk about the information that we do have. 300-ish pregnancies.
300 is pregnancies about birth defects, and in a positive note, it showed that there was no increased risk above the general population.
Great.
Yeah, excellent.
Which is, I mean, reassuring, but for me, I would rather have a lot more data to support that.
We definitely need a lot more people studied to be able to confidently say this medication likely does not increase the risk of birth defects, but we just don't know that.
So the other good news about Trazodone is that it was initially designed to be used at much higher doses than we use it now because it was originally designed to be an antidepressant medication. And it is an antidepressant medication in its own kind of world.
It doesn't work well as an antidepressant, so nobody really uses it for that.
Because it made everyone so sleepy. Right, too. That too. So we use it at doses of hundreds of milligrams, 600-700 milligrams is what I remember. I've never even used it that way. Maybe once in residency, I would say. But for insomnia, we use like 25, 50, maybe 100, something like that.
Yeah, I think the highest dose I've seen for insomnia is like 200 milligrams. So they did study women taking 50 milligrams at the end of pregnancy, and this was just a handful of women that they looked at. And for those women, their babies did not have any complications after birth. So no like neonatal adaptation syndrome like we see commonly with the SSRIs and SNRIs. But again, they only studied like a handful of people, so we can't really say that that's accurate.
Right.
They also showed that and I think one study showed there's no increased risk of preeclampsia. Again, just one study, so we need more. And then also no increased risk of baby being low birth weight when they're born. There are only 2 studies really looking at baby being born early, so preterm birth. And one study showed there was an increased risk. The other study showed there was not.
Right. And I really wonder about the studies, whether they were controlling for other variables, right? Like insomnia is very common in pregnancy, and it's very common with other psychiatric disorders, right? So it's one of the core features of depression. It's one of the core features of anxiety or bipolar disorder. So we really, I mean, I don't know the details of that study specifically right offhand, but I would say I would like kind of want more information to be able to have a detailed discussion about it.
Yeah, because depression when somebody's having depression, that also increases the risk of baby being born early. That's a very well-established thing that can happen in pregnancy. So we don't know that if they, we can't tell if these patients, that's the reason why they had increased risk of that, or if it was actually from the medication.
So this discussion about trazodone in pregnancy, like maybe you and I can have a discussion about it to say, like, it's not something I turn to first line, but kind of similarly to, the way we have discussions about other medications, if this is what we know works for someone, I would probably just have a discussion about, like, we don't have a ton of information, but we know that this helps you, and we know that insomnia is not risk-free.
Especially if baby has already been exposed to it.
Oh, yeah, totally.
Like if baby's already been exposed to it, I'm not going to take somebody off of it and put them on a different medication, because then I'm exposing their baby to 2 medications in pregnancy rather than just trazodone. And we don't have any evidence saying, hey, it's bad. We just don't have a lot of evidence telling us that it's good or not.
Right. Yeah. So it would just be a nuanced discussion that I would have. It's not the first line that I'm going to try.
No,
Probably.
it probably wouldn't even be third line for me.
Right. Yeah. I agree with that. Yeah. Hopefully that's helpful for people, that the information we do have is reassuring. We don't have enough information. I mean, we pretty much just like leave that as a ticker at the bottom of the wall.
Yeah.
The information that we have is largely reassuring, but we don't have a ton of information. Like on the news.
And and I would say that
It's really important.
And I would say that insomnia in itself can increase the risk of postpartum depression. Those two things have some correlation. And so we don't want to not treat somebody's insomnia. It's really, sleep is so important. If you haven't already, go watch our other videos on sleep. Mental health and sleep they go hand in hand. Yeah. And so we really need to be treating somebody's insomnia if they are experiencing that in pregnancy.
Yeah. Yeah. Okay. I think that's a helpful one. Good. Thank you so much for being here. Please like, comment, subscribe. We will see you soon.
Bye.
Good. Done. Let me too.